is that we'll provide you with some high value information and inspire you to be motivated and make some healthy changes in your life. We even make sure to give you some good action items at the end that anyone can do. So make sure you stick around to the end so that you can get those items and make some good, healthy changes in your life.
All right. Yes. Stick around
Yes.
to the end. I'm Coach Brandon. If you're with us live on Facebook in either of our groups, or if you're following us on one of our profiles, that's fantastic. Give us a thumbs up. Let us know you're here. Ask some questions. You are hilarious. If you are not in one of those places, you can watch us do this live, and you can ask questions, and you can be part of the conversation.
Yes.
So please do that.
Yes.
All right.
Please do.
What are we talking about today? We're talking about mental health.
Yes.
So we've been looking into some recent peer-reviewed studies. So we decided last week, really based on a comment from one of our members.
See, we do listen.
We do listen, yeah. And he brought up the mental health benefits of exercising, and it was just sort of a one-off comment, but I really felt like it was an opportunity to bring up something, to talk more in depth about something that really doesn't get a ton of attention. I think you hear it quite a bit, but we never really get a chance to sort of dig into the research and talk more in depth about it. So,
and it sparked a really good conversation too. So why not talk about it with you guys?
Yeah. So it's fascinating stuff, right? Like this, and of course, it reminds me of some of the work I've done either here or at the VA. So, this is going to sound redundant, but like all of us know that senior who doesn't act like a senior, right? And and they're usually a lot happier than their peers, right? Like active. So the redundant part, I guess, is that people who are healthier are happier, right? And that is obvious. I used to see it at the VA all the time. Yeah, shocking, and it makes sense that that healthier people are generally going to be happier, simply for the fact that they have less, health issues. But there was a really noticeable difference when I was working at the VA between like in alertness and mood and cognition. Amongst those, who were active and those who weren't, even those who weren't yet experiencing significant repercussions of being physically inactive, just weren't as like cheerful and happy as my patients who were getting regular exercise and being out and being active. So also as a person in recovery, like I know how important exercise is to my emotional well-being to this day. So it's, at the beginning, it was really important for me to just kind of like keep my head from, being on fire and sort of keeping like cravings and sort of all the new stuff, emotions that sort of come up when you first get sober. So, that was really important at the beginning and really in a really profound way. But today it is really this simple. Like I feel better when I exercise. When I don't get exercise, I can feel my mood getting worse. Same. There's plenty of evidence to support these things as well, in the field of recovery. But that's a different discussion, but it bears mentioning, obviously in this discussion today. But today we really just want to talk about exercise and what it has to do with our brain health and our emotional health. So like I said, we were diving into some recent peer-reviewed studies about the effects of exercise on mental health and brain health, especially as people age. And it's pretty fascinating stuff, right?
Yeah. The link between physical activity and cognitive function is really fascinating, and it doesn't really get a ton of attention. It's not ultra
Right.
sexy, but we have several members here at the gym who bring up how good they feel because they're now consistently active.
Totally. Yeah. What a difference it has made for a lot of those people. Yeah, we do. We get a lot of that.
We get a lot of that. Yeah, we really do.
And somebody comes to mind, actually the person who brought up the mental health thing this time last week. So we decided to do a deeper dive and check out some of the studies that have been done.
Yeah, and I recently came across a study. It was published in the Journal of Aging and Physical Activity. Super fun.
I know.
And they found that regular exercise can help improve memory and attention in older adults. So not just physical health, but talking about being able to pay attention and improving your memory. That's pretty awesome.
Yeah, I came across a few studies that revealed the same thing, that supported the same thing. A similar study in the Journal of Neurology that suggested that exercise can actually increase the volume of certain brain regions, right? Like the actual size, right? That's interesting. Like to me anyway, particularly those memory and learning centers. So, that to me was just a trip. Like just that exercise can actually improve the size of those areas, which is important.
Grow your muscles, grow your brain.
Right. Like actually. There's also evidence that supported the idea that exercise promotes the release of neurotrophic factors.
You can do it.
I know. Yeah. BDNF, which encourages the growth of new neurons and connections in the brain. So right. So this kind of explains why exercise has such an effect on cognitive abilities.
And also, let's not forget the role of exercise in reducing the risk of neurodegenerative diseases.
Yes.
Right? A study I guess we're all having a hard time talking today.
Well, there's a lot of big stuff.
There's a lot of big stuff in here, but there was a study that got published in the Archives of Neurology that showed staying physically active can significantly lower the risk of developing conditions like Alzheimer's disease. And when it comes to neurodegenerative diseases, the healthier you are before you have a diagnosis or a disease like that, I personally have witnessed how beneficial it is in slowing the progression of those diseases.
Absolutely. Absolutely. That's tremendous. And I think it's, it's well known that exercise is the most important intervention in slowing some of those diseases.
Yes.
Like I worked with Parkinson's, like very closely with a lot of Parkinson's patients. And that was the number one factor, right? The most important thing was getting regular movement and exercise.
Yep.
To slow the progression of that disease.
Absolutely.
And it's also how I started Contra Costa Fitness, actually. This is working with that particular population. But the fact that exercise is imperative to preventing them is, I think, really underappreciated.
Yeah, I agree.
You also know that one of my favorite benefits of exercise is that it can also modulate neurotransmitter levels like dopamine and serotonin, which are, those are pretty key in mood regulation, right? Which we were just talking about. So, I gave you some subjective, my subjective experience, but it's also very much backed up in the research. And I think we all know, right, that we feel better.
Yes.
After exercise and when we exercise regularly. But it's always nice to have some of that hard data, I think, which we found when we were looking through some of the literature and studies. There's plenty of research that highlights how regular physical activity can help alleviate symptoms of depression and anxiety as well.
Especially in older adults.
Yes.
Yes. And
Yes.
you know,
Actually found it in kids as well, as
Ooh.
younger subjects.
So it's beneficial for everyone.
Mm.
And you know that I am a big believer in the power of exercise to relieve stress. It's very helpful to me. The release of endorphins during physical activity actually can have a pretty calming effect on the mind. And there was a study in the journal Health Psychology that linked regular exercise to reduced stress levels and improved overall mental well-being. And so speaking of mental well-being, let's not overlook the social aspect of exercise, right? Especially in older adults who don't get out as much. Group exercise classes or even just going for a walk with some friends can provide a really good sense of community, which a good sense of community can combat the feelings of loneliness.
Totally. Yeah, I don't think you can overstate that as well. Like as we age, it becomes harder and harder to maintain a healthy social life.
Yep.
And we talked about that a little bit last week as well, how we tend to like isolate our aging population in this country, and we don't have multi-generational homes here the way we see in other countries.
True.
And that has a much bigger I think it has much bigger health ramifications than we realize, or that is generally like talked about. I recognized early in my physical therapy career how powerful the group exercise experience is for any age group, but especially for seniors. It was crazy. Like those folks showed up. They were there for that. And it kind of started to feel like at one point, like I could be teaching anything, as long as people were moving and together. They were just it was really, really powerful. It was really powerful. So when you combine the physical and cognitive and social benefits, you have this really, well-rounded, holistic approach to overall wellness, right? That we're seeing can really not only prolong lives, but also maintain a much higher quality of life.
Totally. 100%. I agree. And I think it's super important for us, especially in the industry that we're in, to make sure that we communicate this information to our members, to you guys, our listeners that maybe aren't members at our gym, and especially those who might be hesitant to start or continuing to exercise as they age, right?
Right.
It also doesn't mean that exercise has to be super intense or super crazy either. You don't have to go jump out and start doing CrossFit. It's just all about staying active in a way that fits your fitness level, as well as fitting in with your life, whatever that may be.
Yeah. And I'm glad you really like brought that up. Like, it's not just, about like sets and reps and, and intensity, right? Like, yeah, it's good to challenge yourself, certainly. And that's a whole other conversation that we've had and will continue to have.
Probably we'll have it again several times.
But well, as long as it keeps coming up, you guys keep asking questions, we'll keep answering them. But yeah, it's about, doing what the things that improve people's daily lives, help people live better lives. So it does not take a lot, all right? Just like we always say, like it takes consistency. Challenge yourself a little bit, but a little bit every day it makes just such a tremendous difference. So
consistency is key.
Yeah. So.
And one of the things that I love about the community we've built here at Contra Costa Fitness is the idea that exercise can be something you enjoy and you can see the benefits it has in your life, regardless of your fitness level, right? It's really fun for me personally to get to participate in the classes with our members that you're teaching. And I can up my game a little bit if and when I want to. if and when I want to. But also while getting a workout alongside friends that maybe have a different fitness level than I do, whether it's higher, lower, whatever, and they're just working at their own pace too. And I like it that we make sure they know that they don't need to be competitive with everyone else in class, and they actually just get to enjoy the other people, and we laugh and we joke and we have tons of fun. And even through the hardest workout that Brandon might put us through, it is pretty cool though to see and to be part of. Don't you think so?
I do. Yeah. I love it. That's why
I do too.
we put it together this way.
Yeah.
So
what are some action items we can give people to have some fitness and active aging? We talked about community, but maybe you don't live close to us and you can't pop in to Contra Costa Fitness and take a class.
Well,
so
I think
what should
it
you
is. I mean, I think that's the strongest piece, if I'm being honest. Like, I really think, and it doesn't necessarily mean like out in your, in your community, like out in public. Like maybe it's with, a family member or a few family members, a friend, or gather a group of friends. I used to teach classes at our local senior center, which was fantastic. I used to love that, and so did everybody who was there, all the participants. So that's kind of number one. Like if you don't have a sober well, talk to me about that if that's an issue too.
That's another conversation.
If you don't have an active community, or at least some friends who you can be active with, take some steps to finding that. And there are plenty of resources in community centers, etc.
And you can also go online and find meetup groups of people who go for hikes, go for walks. When we say fitness and activity, it doesn't mean you have to do a workout. Find a group of people or another person, individual, and go for a walk.
Yeah.
Go to a dog park. If you have a dog, go to a dog park and do something with other people who have dogs. Everybody's dog needs to go for a walk, right?
Totally. Yeah, some really need to get out and get walks. And then to like sort of counter that, it's good to also be able to be active independently. So I think it's really good to, because sometimes people aren't able to be as consistent as we are. So sometimes those groups really provide like a little support and accountability. Sometimes if you're like kind of leaning on a friend who might not be as committed as you are, you might need to make sure that you sort of have your own go-to sort of routine to have, at least as a backup plan, even if it's just basic stuff, right? Have a simple home routine, especially if you live in a place where the weather can be, preventative, and, have just like a few things that you can do at home so you can maintain that consistent routine, because that is the most important part, is to especially if you're in a place where you haven't been active for a long time and exercise is a little bit scary, and you're like the first time you exercise you get sore and a little bit achy. I personally like love that feeling, but I'm a sicko, I guess.
I was like crazy.
I do. I'm like, oh yes, I hit something new. But if that's miserable to you, you want to get to a point where you feel better when you exercise, and you don't feel as good when you don't exercise, right? And kind of flip that script.
Actually, that brings up another good idea, that if you are in an area where maybe the weather isn't as beautiful as it is here in California, and you don't want to leave your home to go for a walk early in the morning or late in the evening, and you want to get some activity in, check out our YouTube channel. We've got all kinds of good stuff on there that you can do something at home.
Yeah. Find your resources.
Yeah,
and
there's tons out there.
again, it doesn't have to be really intense. Like just being out there and moving is tremendous. Like my mom is out gardening like
Hmm.
every single day, and I'm pretty sure that that is keeping her young. And there are groups, that like community gardens as
Yep.
well. It's a great place to go if that's your jam.
Yep.
Go and do that.
And it's come
Um,
up a lot in the last couple of weeks, but even just 5 minutes a day. Just take 5 minutes a
totally.
day,
Yeah.
and
Yeah.
that is super beneficial. Even if you don't want to do a
Yeah.
whole lot, a tiny little bit can go a long way.
Yep. Yep. Just start that routine a
Yeah,
little bit every day. And, if you feel like doing more, that's great. If you don't feel like doing any more, that's fine too.
perfect.
But yeah, just get that consistency. If you need help, knowing what to do, a good,
Hmm.
like, yeah, I mean, go ahead and reach out.
Oh, there you
Please do.
go.
Please do. That's fine.
We're happy to help.
What I'll likely lead you to is, just so you know, is just some like the like kind of foundational functional movements, right? Do a squat, do a lunge, do a push and a pull. Um, and that'll get you really started, and then
Yeah.
you can also add like a hinge, right? A hip hinge, a rotational element,
Carry
and a
something.
carrying element. So yeah, squat, lunge, push, pull, hinge, rotate. Some people don't include rotate, but rotation or anti-rotation is really important. And carry something heavy
Perfect.
that challenges you. And if you include all of those elements in whatever you're doing, then you should be pretty good.
Yeah.
There's always more to talk about, so
Always.
we will continue the conversation next week.
And if you have questions, reach out to us. Ask us your questions. We'll answer them.
Absolutely, yeah, we're always happy to do that. So we really do. We care about you guys. We enjoy reaching out to people. So if you share, you ask questions, we'll get back to you.
Absolutely.
And if you're not in our community yet, what the hell are you waiting for?
Yeah, get over
Join the
here.
discussion live. Ask us those questions. And you guys who are in our community, keep doing what you guys have always done,
Hmm.
and that's inspire us,
Totally.
inspire each other, be vulnerable when you're feeling vulnerable, and raise your hand, and if you see someone's hand, um, you know lift them up. Keep
Yes.
lifting each other up. All right, love you guys. We will see you soon.
Bye, guys.
Bye.